Hey besties, welcome back to the Nurse Aspect where we assess and evaluate. My name is Nurse Becca and today we have on the show Danie. Welcome.
Thank you. Thank you for having me. This is an incredible space.
Oh,
to
thank
have.
you.
It is like a safe space for nurses.
Thank you.
This is awesome.
Oh my gosh, sorry, no. Thank you. We're going to get right into it. So tell me, why'd you get into nursing?
So I think like others, we have like, I think some nurses, they end up having like a health issue that sort of propels them into it. So my brother and I, we were both diagnosed at birth with sickle cell thalassemia. And although he did not have as many pain crises as I did, we both dealt with it in different ways. And being in and out of the hospital constantly, you understand how it feels to be on the other side. And you have your experiences with incredible nurses that can make or break your stay and how you recover. And you have not the best nurses. So there was a drive or desire to be the impactful nurse, to
Wow.
make that life experience that is not as easy as others, quote unquote, right?
Yeah.
Not normal, and to be impactful on their lives. So, yeah.
Wow. That's really commendable. I know I definitely understand how like a lot of people go through that, not particularly sickle cell, but, just in being able to have some sort of experience where, maybe you went to the hospital or maybe you saw someone else go to the hospital
Right.
and nurses can definitely make or break your experience. Like the doctors you see for 2 seconds, but
Yeah.
really your nurse is really who you're there with the majority of the time. Yeah.
And especially being a child, right? Because as much as you would like it, your parents can't be there all the time.
Right.
So they end up taking the role as your parent, in pediatrics especially, when they can't. And this is not your home, you're in a completely different environment, you don't feel great. So you're relying on them a lot. So I just wanted to, be a blessing to another child, like the nurses that were a blessing to us.
Is there like a specific moment that sticks out to you that made you be like, yes, I definitely want to go into nursing, or was it just a culmination of experiences?
I think it was a culmination of a lot of experiences. But what I'll say, and I'm sure like many know, sickle cell is a primarily like minority illness. And it comes with a lot of stigmas. And having to constantly advocate or fight for care, to be understood, to not be stereotyped as a med seeker, right? Or a pain medicine seeker, and be seen because for many reasons, it's not an illness that you can physically see. And with the lack of understanding and the education, you're constantly fighting for care, constantly fighting to be taken care of well. And it's hard enough being in that situation to now have to fight to get better with the healthcare system and the doctors to put in orders. So, and seeing my mom have to fight them. So I just wanted to change that dynamic, even a little bit, even if it was just me, just to be that light a little bit for somebody else.
Yeah, that's really commendable. I feel like a lot of times people do go through things and kind of shy away from like, I went through it, but I can't even see myself helping someone else.
Yeah.
Or, so it's really commendable into your heart and how you are as a person, that you want to not only give back, but help those that may be going through the same thing. So what exactly do you do? Or where did you go, when you made your decision?
So I honestly thought because of our illness, or I'll say what I was diagnosed with, I'm using my words wisely, that I would go into peds hemonc. And then I did my clinical rotation, and, you know, that's sort of where you see, is that really where I want to be? And I stepped foot on the pediatric ICU and was immediately, that's it. This is exactly where I needed to be. And I had incredible nurses on my rotation that said, don't worry about that med surge thing. You don't have to go through that first. If you want to go in the ICU, you apply for the ICU. And I did it with radical faith. I passed my boards, and I immediately only applied to pediatric ICUs.
Baby, let me tell you, we are total opposites, because I was looking at peds like this is the bottom, the absolute bottom of the barrel. Like I'd go to psych first. I'd go to psych. I'd go
Really?
peds was at let me tell you know what? And the thing is, it's funny because working in labor and delivery, it's like, it's not a far stone away.
It's not.
But to me, dealing with babies and mom is totally different than dealing with a child that needs care, that is sick, and their parent, you know?
Yeah.
It's totally different. And I don't know what it was. Pediatrics, my heart goes out to all of you guys. I wish I can give you like a hug or whatever. Like, you know how they hand out like purple ribbons and stuff. Like to me, like what color ribbon do you guys want? Because I just could not do it. Peds is just so at the bottom. It's right next to research for me. Like right next to research. Both at the bottom of it. So this is like, okay, I'm gonna take everything you say in stride.
You know, it was honestly, I think it was just a grace. It's just a grace on your life. And nursing in itself is just another beast. You know what I mean? Like,
it is.
You can't, for the ones that decide, oh, you know, I'm going to do this because, you know, it's flexible and all the conveniences of life, you know, financially, schedule-wise, you get weeded out real quick.
You do.
Because you have to, it does not matter what travel assignment, how much you are paid to get up and show up on that unit. It is not for the faint of heart.
It's not.
So you really have to want this. Like you gotta want it. And I think it's outside of you, right? Like nursing deals a lot with like the ministry of healing. And whether we know it or not, there are a lot of us that don't know our giftings and go into it because of already having that anointing, right? Already having that grace on their lives. Like whatever I carry is able to impact and help in the assistance of healing these kids.
Yeah.
So I don't have, I'm trying to figure out if I have any other friends in nursing that do peds. They are all like, they run away from it like a plague.
You know what? I can't even, like, I'm just trying to like think back, like what exactly was it that I did not like about peds? Honestly, it's funny because like to me, initially I wanted to just be like, honestly, the diseases was so much, but I could say the same thing for psych. There's so many psychiatric diagnoses that literally like balancing medications for psych patients is, you know, working in psych in general is a beast.
Yeah.
I was in cardiac and balancing cardiac medications, procedures.
That's what I'm
and so
saying.
to me, I'm like, I'm saying the same thing about peds, but what exactly is it? And it just wasn't for me. That's really what it comes out. It just was not for me. I really couldn't do it. And honestly, I didn't even have a bad experience in clinicals at all. I literally had the best experience. I had the best experience, to be honest. Like I didn't have like issues with like the families or anything like that. The kids were, you know, they were great. It was not like I had like kids that were crying that'd be like, oh my gosh. It just was not for me.
Right.
I honestly, to me, I feel like I could not, I guess at the end of the day, and a lot of people I guess could also agree, dealing with like maybe a kid that is dying is totally different than dealing with an adult. But I say that, but I've had patients that died that were 25, you know what I mean? Like, it just wasn't, you know, for me.
It is, what I'll say is, well, first of all, I almost felt completely defeated when I was going through nursing school because the lowest grades that I got was in peds.
That's what it was for me. And
like,
maybe that's why I was just like, okay, that's not for me.
Right. I'm like,
that's crazy though.
This isn't really looking like how I thought it was going to look.
But did you feel that you wanted to go to in peds even in nursing school? Like that
Yeah.
was okay.
I thought it was going to be like hematology, oncology,
Yeah.
because that is, I'm accustomed to it,
Yeah.
right? But when I went on that ICU, it was, I think it's just the atmosphere. Like there's just a different, it's just a different environment on the, in the ICU. And I liked how hands-on the nurses were. And I also liked, in the ICU, the doctors are right there. Like I don't have
Yeah.
to go through paging somebody, waiting for somebody. What I was a bit terrified of was the NICU, to be honest. And where I did my rotation, they were like, "Oh, don't worry, we don't get any babies younger than 2 months here." And then where I ended up working, it didn't matter if that baby was 3 days out of the NICU. They were going to be on the floor. So many times you thought you were running away from the NICU and you end up getting practically a NICU admission anyway. So it was a lot of stretching. It was definitely a lot of stretching, but it is as equally rewarding as it is tragic, because I feel like sometimes with adults or like geriatrics, you're sort of treating to like a means to an end, right? In a way.
In a way,
right?
because it's yes, and compared to pediatrics, yes.
Yeah.
Yeah.
But if you get a trauma child, right, their ability to regenerate, their ability to bounce back, is the resilience that these kids have is just, you're in awe when a kid comes in and they are paralyzed from the neck down. And within a matter of months, you're watching this 2-year-old run down the hallway. Those are the, okay, like not that others don't do things, but for me, it was like, oh, like I'm really doing something. Like I'm really assisting in restoring a life that they can have longevity.
That's
So
amazing. I'm not gonna lie. Just speaking to you makes me kind of be like, maybe I need to look into pediatrics. I mean, I say that, but what?
But there have been some very long, tearful rides home.
I was just about to ask you, like, what are some of the challenges?
So the first time, there's this sound that comes out of a mom that is not of this world. It is not of this world. I was still on orientation. This was my first brain dead experience. And she came in, she was like at an amusement park, and she was doing the pirate ship ride. And it was for her 16th birthday. And she was fine. She walked off of the pirate ship, unresponsive. They rushed her in, they helicoptered her in, and emergency MRI, emergency CT, all the things. And she essentially had an AVN. And
Before you continue, can you explain what's an AVM for those who may not understand what AVM is?
so it's sort of, there's like a malfunction with the artery and the vein inside of the through the blood flow in the brain.
Okay.
So it's sort of similar to like an aneurysm, or it can essentially do the same thing as an aneurysm, but they're rarely found, and especially when you don't have any other conditions. But the pressure of the ride, essentially it popped. And by the time she arrived, the blood flow, there was not enough room, and not enough time to even put a bowl, to even drain it or anything like that. And I had seen the attending, it was a Hispanic family, and I saw the attending go down on one knee, and I didn't know why, right? And she was using the translator and basically explaining to the mom that her daughter is brain dead. And there is very little that can be done after that point. And we sort of just watched outside of the room. And when the translator translated it, the wail that came out of that mom, and I understood why she went down on one knee, because the mom literally collapsed on her. It didn't matter if you worked in that ICU for 20 years. It didn't matter if it was your first day. There was not a dry eye. It is like a sound that you can't unhear. It's sort of just ingrained in your soul. So yeah, so those are, it's heavy. Those are heavy. And not as though other fields don't, deal with that level of trauma and unexpected deaths. But there is just the sound of a mom losing her child, like an invisible umbilical cord that just tears. And those are hard. You can't nurse your way through that.
Yeah.
You have to just, as a human, you just have to let it out. You just have to let it out. So yeah.
I mean, I
know that was heavy, but
I honestly, I can't even imagine, like, even as you're talking, and it just, again, this is what I'm saying, like, I commend every pediatric nurse out there, whether you just in a regular peds ICU, even NICU, just dealing with that kind of loss. It doesn't compare to a loss of an adult, obviously, because you expect your kids, to have the rest of their life to
have their life, right.
And like seeing something like that is just so painful, even though, like, I'm not a mom yet. I never went through that, and God forbid I don't ever want to.
You don't.
You know what I'm saying? But just like,
and
you
won't.
can hear. Thank you. You can, like, just as you're telling, I could feel the emotion of, like, oh my gosh, this is sad, incredibly sad. But like I said, I commend you on all that you do. Are you still in the ICU right now?
I am not.
Okay, so what are you doing now?
I am not. So I am actually starting a position that I didn't actually know that I wanted and that I needed until God placed me there.
Let's talk about it.
So throughout my nursing career up to now, I started to realize that what I was doing was way bigger than me. And that I was just a vessel that God was using to minister the healing or the understanding, the comfort that He needed His children, right, and these families to receive. And when I began to do that, down to points where I started, just out of obedience to Holy Spirit, I started praying with my families, even in the ICU. And I was timid at first, right? Because you don't want to offend anyone. You don't want to cross any lines. But He gave a lot of reassurance, because those same families would ask for me to come back. And even if I didn't have their child, they would say, Danielle, if you're on, can you just come in and just pray with us, just pray over, our child, and even over, to strengthen marriages, because that is I commend my parents. Raising children in itself can take a toll on marriage, but to go through traumatic experiences or to see their children not well, it's a totally different beast. So even if it wasn't for the child, but just to strengthen their union, to keep going through this season, I realized that it was bigger, and I was gaining more reward in those situations than the normal task-oriented day-to-day nursing flow of things. So when I had my daughter, I had left the ICU just because it was just a lot. And I just needed to be mom for a season. So I needed a position that would allow me to be a mom and to, pump, feed my child. And then I took some time off, and I had gotten an opportunity for a nurse coordinator position. And I was honestly unsure, but I just moved in obedience and applied. And within hours, they responded, like hours, within hours. Okay. And it sort of was at a point where I didn't really have to sell myself. It was as if
It was created for you.
Right. It was just created for me. I was able to, ask for a schedule that is flexible enough that I can pick my kids up, drop them off. But it is coordinating like the entire care of the individual. And I realized when my nursing responsibilities started to expand personally and even spiritually, that's what I desired more. Not just, the acute care, you get them well enough to be discharged or downgraded, and then you really don't know, the rest of the work that has to be done at home. And I understood that hands-on, because even going through crisis and needing to be hospitalized, they get you well enough to a point where you can, physically move or walk.
Right.
But then you have a whole nother recovery process at home that you don't have the 24/7 care support, or your parents don't have that support to be able to still nurse you back to health, for you to be 100%, to go back to school or to go back to work. So in this position, I'm able to assist these families with the entirety, all of the assistance, the resources, the additional care, the different therapies and treatments that they would need, that they can have a better quality of life outside of the hospital, right, or outside of long-term care, and help them feel, a bit more quote unquote normal, right? Live a better quality of life than just hospital and home.
That's amazing.
I'm excited. I'm excited. I know that it's going to stretch me, but God has given too many confirmations that this is where He needs me in this season. So I'm just moving in obedience.
If you didn't say it, I was going to finish the words for you, girl.
I am just moving in obedience. I'm moving in obedience.
That's great. I honestly, even just hearing your story, I feel like the role was created for you, So I look forward to hearing your journey in that. Don't be afraid to come back and tell us this is exactly this. Let me give you all the tea. This is exactly what it's like. But yeah, that's super amazing.
Yeah. And it's intimate, right? So I can be in the home, and God can have that freedom outside of the, the schedule.
I have another patient to go to. I can't stay here. Like sometimes I will say sometimes that that does kind of get a little frustrating sometimes, like when you are kind of bonding with your patient and, or the family, and then, you have, either your patient next door or someone else, or then now you have a cold or you so it kind of interrupts that moment. So that's actually really well. This is the nursing that's supposed to exist in the NCLEX hospital. Thanks for listening to another episode of The Nurse Aspect, where we assess and evaluate. Keep it locked in next week for part 2.